My mom's Medicare was giving her a shot every month in her eye to keep her eyes healthy and keeping her from losing her eyesight for her to be able to see. But since Trump was in office and he cut so much shit, he cut her Medicare off. So now my mom is going blind. My mom is going blind because Trump cut the Medicare. Don't ask me how I feel. Fuck this fucking country. Medicare was paying like almost $9,000 or $10,000 a month for my mom to get the shots in her eyes. But since they cut it off, now she has to pay $5,000 a month. And I think that's for each eye. So I don't know if it's for each eye or just one session, but it's a month and that's very expensive. Like, I don't know what we're gonna do, but I really hate that my mom is going blind and she won't be able to see me or my kids again real soon. Like, she has 30% of her eyesight, and if Medicare don't find any programs to help her, she's gonna go completely blind. I don't know how to feel.
Listen, that shot in the eye cost more than most people pay for rent. And that is one eye, basically once a month. You will hear 5 more peoples in this video. You will hear 5 more people in this video. And they have never met. And one thing before we start, English is not my native language and actually I'm not American. That's why I count things instead of arguing about them. Today we count what the US already spends on health and who just stopped being covered by it. Welcome to the Bulat in America.
I want to just go over what happened with that letter I got yesterday about my Medicaid. I had no idea that my account was being, they called it a review. However, when I logged into my account online last night, it said that I did not need to reapply until February of next year. So when they tell you that these Medicaid cuts are not going to happen until the end of next year, they're full of shit. Just so we're clear, they are reviewing people's accounts and kicking people off Medicaid right now. And I know this because I'm one of those people. So if you are on any of these programs and you have access online, if I were you, my best advice to you would be to always log on and look and see what's going on with your account. I had no idea that a new application had been submitted for me because I did not submit it. I don't need to until February, but they've already kicked me off the program. So, and my son, who was a 19-year-old high school senior, they have put him on his own account as an adult. He is also autistic, and his Medicaid ends October 1st. So there you have it. There you have the big, beautiful pile of shit bill in a nutshell. And if this is going to happen to millions of people, and it has already started. Thanks, MAGA. This is what you voted for.
Hey, well, he's getting rid of Medicaid. And here in this very poor, very red state that I live in, Medicaid is under a program called TennCare. That's our version of Medicaid. And it's 65% federally funded. So when that money's gone, a bunch of you all are going to be dropped from TennCare. I hope they keep kids covered. But the rest of you, you're going to be in my world. Either you're going to have to pay for coverage or you're not going to have insurance. And you just hope you don't get sick. Yep, I've listened to you sing the praises of Trump while getting your TennCare. I've heard you talk about Biden while you got your TennCare. Well, to use one of your all's favorite little sayings, you're getting ready to find out.
Now, one of them got the letter and one told you who pays for it. One of them got the letter and the other told you who pays for it. They call it a review. Nobody picked the timing pretty much. Did a letter come to your house this year? Please write it in the comments. I read all of them. Paperwork moves first.
As a physician that takes care of Medicaid patients every single day, I want to talk a little bit about the bill that was passed yesterday, what it could mean for people like my patients, and what it could mean for the overall healthcare system. This bill specifically is going to require Medicaid patients to have strict work and reporting requirements in order to maintain their coverage. Here's what I see every single day. We have people that are recovering from surgery. You have patients with chronic diseases. You have people that are caring for family members that are ill. They just can't go to work to clock in. They can lose their coverage not because they're not willing to work, but because life just isn't sometimes that simple. Here's the biggest part of what you need to understand. If these patients lose coverage, they're not just going to disappear. They'll have to wait until their symptoms get worse, and then they'll show up in the emergency room. Not because they want to, but because that's their only option. That means diseases are going to be caught too late. Patients are not going to have access to medications they need, and there's going to be preventable emergencies. We already see this, but it's going to become more and more common. Here's the part that most people don't realize. When millions of people lose healthcare coverage, the entire system is going to feel it. So hospitals are going to take on more unpaid care. The costs are going to have to go up. Don't vanish. They show up in higher premiums, in overcrowded emergency departments, and limited resources for everybody. When one group loses access to coverage, we will all feel it eventually. This isn't about politics. This is about people. What we need are policies that are going to strengthen access, support prevention, and value long-term health.
Are you ready for your local hometown hospital, your nursing homes where your loved ones live at, to close down? Are you ready to lose your job that you've had for decades? Well, guess what? Because this big, beautiful bill has been passed, not only are millions of Americans losing health insurance, but hospitals, nursing homes, and other medical entities rely on Medicaid payments to stay alive. This is the largest healthcare cut in U.S. history. So geez, I'm really sorry. I hope you can find a place for your grandma, your grandpa, your mom, your dad, your sister, your brother to live. Honestly, I just hope that if you did end up losing your critical access hospital in the middle of nowhere to these cuts, that somehow you can survive the extra 30, 45, 60 miles away to the next hospital. You can thank your politicians, the Republicans, Congress, and President Trump for that. And if you're about to be upset that, gosh, Emily, I hate that you're being political, healthcare has always been political. I grew up in a Republican town with a critical access hospital, and I'm proud of my roots. But honestly, these politicians don't care about your healthcare, and they don't care if you die. All they care about is saving money, even if it's at the expense of your life and your loved ones.
Here's the thing, you just heard the same building described from the inside and from the outside. About 150 rural hospitals have shut their inpatient doors since 2010. That started long before this bill. And to be fair, the building goes first.
That was what I had to do, go to the emergency room and pay the bill somehow, some way.
Wait, how do you have health insurance?
How do I have health insurance?
Yeah.
I pay for it.
So is it through your employer?
Through the state. I'm also on Medicare.
The Trump administration wants to defund it. Yes.
Right. I don't believe it. There's no evidence of that.
Well, he did it already. The big beautiful bill defunds Medicare.
Oh, really? That's why I'm still on Medicare.
Yeah. It's gonna defund it after the midterms.
Really?
Yeah.
Okay, we'll see when that happens. Because I'm still paying for the service. It's not free.
I'm aware. I mean, but
They
yeah.
take it out of your Social Security check.
I want you to get Medicare. I want people to get Medicaid. I want you to be able to live in dignity for the rest of your life. And the Trump administration is actively trying to defund the things that you need to live.
I don't believe that.
And it's going to kick in
I don't
after the
believe
midterms.
I don't buy that, and we'll see what happens. You're looking into the crystal ball.
I'm
You're
going to
looking into your crystal
I'm going to
ball.
put like a little blurb right here showing what the big beautiful bill defunds. Basically, it's going to go right here.
Right.
So, it's
So
gonna
you
go
can
right
prove
there.
that I'm ignorant. But
Yeah.
that's
Yeah, it's gonna
okay.
go right there.
I don't believe you. I don't buy it. I know you're a left-wing liberal, and a lot of things you say are kind of like, slanted.
How about this? We see each other at MAGA events repeatedly. Can you make a commitment that you're going to look that up?
I certainly will.
Once you've looked that up, you can come back to me the next time you see me.
Yes.
And you can say, hey, you know, I looked it up. Let's go over the nuances of that, right? And then we can have a proper discussion on that.
All right.
Thank you.
Walter, it's been a pleasure.
Thank you so much.
And here is where it gets weird. Every one of them told you the same story. Not one agreed on who did it. The man you just watched said he would check it himself. And I mean, almost nobody does. So here is the part none of them counted. $15,000. That is what the US spends on health per person every year. Okay, take out what never reaches a patient. Take out what the paperwork is. What is left is still the most expensive care in the world. I read that number twice. I thought I translated it wrong. So the fight is not about whether the money is there. At this point, it clearly is. My home country, the state pays for a fixed list. Ambulance, primary care, cancer, chronic conditions under watch. Not a free medicine. Just a list. Of course we have underwater stones, but it is what it is. I counted this from the outside, and if my numbers are not correct, please correct me in the comments. I read all of them. And if you like this video and you want more, please subscribe to me and see you soon.